Hi, everybody. It's Monica Heltz with your daily Fishers Health Department update. Just a couple of things for you today. First off, our positivity rate today is 5.2% at the county level. That has gone down. It's a little bit different. The way that the state is reporting it now, they're now giving two different rates. We're using the rate that is for unique individuals, so that is deduplicated. It won't count somebody twice. Fisher's testing site percent positivity rate is quite a bit higher. It's currently at 7.5%. So over 7 days, 7.5% of the people that we tested in total have tested positive. Our case rate is at 21, which is still going up a little bit. I'm hoping that we can go down soon, but right now we're seeing a pretty high case rate. So we'll keep watching those for you and letting you know how those are going. In the other indicators, our appointments are, you can get an appointment the same day or the next day. So if you have any question, just go ahead and get tested. At our testing site, we're not having any backlog in our testing turnaround, so you can get those results in most cases within 24 to 48 hours. And in all cases right now, they're in less than 72 hours. We don't have any delay right this minute. So those are all looking really good. Other stuff I wanted to go over was I thought it would be interesting to talk about asymptomatic versus symptomatic folks. What I can tell you from our testing site data is that 73% of people who test negative do not have any symptoms. That also, of course, means that 25% of people who test negative were having symptoms, and that may have been what prompted them to get tested. The converse of that is also true. So 35% of people who test positive did not have any symptoms. So this tells us a couple of things. One, it tells us that 35% of people are positive and they don't have any symptoms, which means that they could possibly infect you, or you could be one of those 35%. So if you have any question or concern, maybe you've been around somebody, maybe you're going to meet somebody who's at high risk, please go ahead and get tested. We have the capacity. The testing turnaround is really good. Meanwhile, 65% of people who test positive do have symptoms. So if you have any symptoms that you're worried about, again, go get tested. The testing capability is definitely there right now. Other stuff I wanted to cover was some information from Regenstrief, which provides a lot of hospital data. If you're interested in that kind of information, you can go there to their dashboard via the State Department of Health's COVID dashboard under additional resources, and you can look at the Regenstrief hospital data as well. This just really highlights for me one of the reasons why we care about more than just deaths when it comes to COVID. So a lot of people, look at the fact that we haven't had any deaths in the last probably 6 weeks or so, and they say, well, nobody's dying. Why are we still concerned about this? And we're concerned about it for a lot of reasons, but one of those reasons could be the long-term effects that it may have that we just don't know about yet. But let me just go over some of the hospital data that I thought was interesting. So the average hospital stay for a person who is hospitalized for COVID, the average amount of time that they're in the hospital is actually 25 days, which is quite a long hospital stay. Most people are not in the hospital for that long for most conditions. So 25 days is the average hospital stay, according to the Regenstrief dashboard. Again, quite lengthy. And that ranges from 9 days to 31 days. So that would be 9 days in the 0 to 4-year-old age group versus 31 days for an individual or for the age groups between 50 and 59. What was surprising to me was that the ICU average stay, so the average stay in the intensive care unit is 18 days, and that the age group that has the longest average ICU stay would be 5 to 15-year-olds at 32 days average time in the ICU. That's a really long time to be in the hospital, especially for 5 to 19-year-olds. You guys, this is not normal. 50% of kids with COVID who were hospitalized didn't have any comorbidities. So just so that you're aware, this is why we're being a little bit cautious with trying to get people back to school. We're trying to walk this fine line between what we know and what we don't know. So I hope this helps you kind of paint the picture and be able to assess the risks for yourself and your family a little bit better. One last final thought in other great, amazing news. There is a outbreak right now of salmonella. So if you happen to buy a bag of peaches from Aldi or from Instacart, and that bag of peaches has the label Wawana on it, that is the brand that has been recalled of bagged peaches. So please throw those out if you happen to have them. There's also an ongoing outbreak having to do with onions. It's in some products that should be recalled already. Just as a reminder, salmonella symptoms are diarrhea, fever, stomach cramps, usually onset within 12 to 72 hours of after eating that item. So again, peaches in a bag from Aldi or Instacart, throw them out. Hope you guys are staying safe out there. Take care. Until tomorrow. Bye.